So as part of our work to really transform behavioral health in North Carolina, we worked with the North Carolina General Assembly to get nearly $1 billion to transform mental health and substance use disorder care in the state. After Hurricane Helene and knowing how much our youngest North Carolinians have been struggling, we worked to prioritize part of that funding to do a $30 million investment in partnership with UNC Health and Pardee Hospital to create a unit specialized for adolescent behavioral health care. This builds on work that we did in the central part of the state where we transformed a facility into a center of excellence for kids. So, these are the kids that often get stuck in emergency departments where nowhere to go, or in DSS offices that are sleeping there, and they need really intensive care. And now UNC Pardee is going to be able to start to provide that care because of this investment.
So this was something that was born recently, this venture to help kids out here, specifically in the Pardee system.
That's right. We have been investing this nearly $1 billion for behavioral health all across the state for the last year. We have been increasing the number of places that you can call, places you can go, behavioral health urgent cares, facility-based crisis, because I go back to moms and dads who are struggling with a kid with complex mental health needs, and they just don't know where to go or even where to start. Our system of care for folks with behavioral health needs has been really struggling for a long time, and this is about making sure those treatment options are closer to home. And we know a big place that we've needed to invest is here in Western North Carolina, and no better partner than UNC Pardee.
When you look back at your years of service, I guess what sort of stands out to you, like when you do look back years from now, what will be like, man, I'm really happy I did these 3 things or 4 things?
So my first real job, my first job was stocking shelves of Piggly Wiggly, but my first real job after college was working at a behavioral health care company here in Western North Carolina. Our offices were in Hendersonville and in Brevard and up in Asheville. And I saw firsthand then that people really struggled. This is a medical issue that was being treated like a moral failing. And so in 2018, I came home after a stint of time in the federal government with the passion of trying to make the mental health system of care work better for everyone, for people with means and without. Fast forward to today, we've invested nearly $1 billion in changing that system. We've expanded access to care for 600,000 North Carolinians for Medicaid expansion. We've done mental health interventions in schools, in the criminal justice system. We've made the crisis system more responsive so that if people need a place to go, they can just pick up the phone and call 988. To me, this has been my passion in this role, and I'm so grateful for all the amazing work, the partnerships we've had to get that done. And
I know, we have the UNC Health Pardee announcement, but you spoke about it a second ago. We had this once in a several generation calamity out here. It's a time when a lot of people are going to need mental health counseling. Have you found folks utilizing these tools that you have set up for them to have in the recent months?
So what we usually find after a natural disaster, first I want to remind everyone, there's no right or wrong way to feel after a disaster. And often the peak of need is about 6 months after the event itself. And so we rush to make sure that people knew about 988. That's our crisis lifeline that people can pick up the phone and call. And right now we're rolling out here in Western North Carolina on the ground trauma counselors. Hundreds of people that are going to go door to door to check in with folks, to normalize the event, to help them know where to go if they need additional assistance. We've pumped additional resources like our partnership with UNC Health, Pardee, to be able to grow more long-term services for intensive care. Thanks to the North Carolina General Assembly, we've gotten an additional $25 million to do more intensive services here in the region. So we are definitely seeing increased utilization, but we know, like any disaster, this will be a long-haul investment, and that's what we're showing up to do and support. This is home for me. I lived in Brevard for a long time, and we're committed.
So I know you went to college at Brevard College, right?
Go Tornadoes.
When you saw what happened here, and you knew you immediately needed to do something because it is home.
I was with Governor Cooper on the tarmac at Asheville Airport right after the storm when C-17s were landing full of semi-trucks worth of food and water, and they were being lifted out of those planes onto Chinook helicopters into every county in Western North Carolina. I had teams on the ground for communities that had been cut off, providing urgent medical care. We were working with local partners to increase access. The immediate response phase was one that required all of government, all of local government, and community partners. It was devastating to see communities that could never imagine this type of disaster be nearly wiped away. At the same time, there were folks that frankly fared like they didn't even see a big change. And that's what's been so hard about this disaster, is it's really uneven. And I think it's important for us to remind folks of that unevenness, because it's going to take a long haul commitment to the recovery for everyone. And just because maybe your part of the disaster wasn't as bad, we can't lose sight of that. And I'm excited for Governor-elect Stein. I know he's really committed to continuing to invest in recovery in the region, and we're going to stay the long haul on this.
Medicaid?
Look, Medicaid expansion is a dream come true. It would not have happened without Governor Cooper being as relentless as he was. You know, at every turn, he said, let's put all of our chips on the table and try to get this done. And what finally got it done was the relationships that we built with local sheriffs, chambers of commerce, frankly, many counties in the West that stepped up, some of the first counties in the state, and said, look, we get that Medicaid expansion is an investment in our local community members who can't get health insurance any other way, who are working in our vibrant downtowns and retail businesses to make our economies grow, but they need to be healthy, and to be healthy, they need to have insurance. They stepped up, did the brave thing of calling on the state to expand Medicaid, and we got it done. We didn't just get it done, we've gotten it done really well. Today, 611,000 people enrolled in comprehensive health care. That means full physical benefits, vision benefits, dental benefits, and a copay that's never more than $4. Millions of prescriptions have been filled. Hundreds of millions of dollars paid to hospitals that would have lost the money for uncompensated care. This is an economic, huge boon for Western North Carolina and the entire state.
Do you think North Carolinians are healthier today because of what your office and the governor did?
Well, obviously, getting access to health insurance is a first step. We see people taking advantage of it. I know people are getting the critical inhalers that they needed, the prescriptions that were saving them. So absolutely, they are healthier, well, and less likely to end up in the emergency department than they were before. We see people getting the dental care that they need. We know how foundational oral health is to well-being. And our Medicaid program, we have been investing, including here in the West, in really nation-leading efforts to lower the cost of care while improving health. We've been doing a pilot in partnership here in the West with Dogwood Health to use our Medicaid dollars to pay for food, to pay for housing, to pay for transportation, things that you don't usually think of when you think of health insurance. But by doing it, and we've just studied it, we found people showed up to the ED less, they were healthier, and even after we paid for the food and the transportation supports, we actually spent less money on them overall because we didn't have to pay for all the emergent health care. We saved $85 per person per month. So we are making people healthier, and we are lowering the cost. North Carolina is leading the nation for what every other state wants to try to figure out how to do.
Awesome. Explain to me why medical debt relief was so important.
So when we think about what really drives health, we think about food, we think about transportation. These are the things that enable you to be healthy in life. Well, for so many people that end up with medical debt, they end up with debt because they had an emergency. They go to the emergency department. That's not the moment in which they're shopping around for a price. They can't afford to pay it. And we find that hospitals, over time, rarely collect between 1 and 3 pennies on the dollar of that debt. But the person feels the full financial and emotional baggage of that debt. And it gets in the way of them going back to the doctor. If you even owe $100 to a hospital, and you try to go in to see your primary care doctor, and the first thing they ask you about is what you owe the health system, you don't go. And if you don't go because you're having a little pain in your chest for that checkup, and that turns into another heart attack, then you end up right back in the emergency department, the most expensive place, and you keep racking that debt up even more. But now, through this novel program that we put in place that costs state taxpayers nothing, hospitals are going to relieve medical debt, $4 billion for 2 million North Carolinians, dating back to 2014. Going forward, they're going to raise the floor on the charity care that's provided, and hospitals are going to have to do more to get people enrolled in charity care in the first place so that they don't accrue debt going forward. When you don't have that debt getting in the way, we're changing the relationship with the healthcare system from one of collections to one of real care. And this is, again, remember, money that hospitals were never going to collect in the end anyway. So we just kind of helped get it out of the way of that healthcare relationship.
Why are and we talked about mental health investments, we talked about Medicaid expansion, we talked about medical debt relief. Why are these things that were of such high interest to you?
I don't think that there is a single family in North Carolina, probably not in the entire nation, who doesn't know at their deepest core that the health system just doesn't make sense. It's confusing. It's hard for them to even know where to start. We've seen some frustrations really on these issues boil to the point of real danger for folks. We've got to make it better. We've got to make it easier for people to navigate. And the things that we've done in North Carolina over the last couple of years are the fundamentals. How to get people health insurance and access to care? How do we start to pay for the things that actually improve health? How do we try to treat things that we know really matter to families like mental health? And how do we take some of the gunk out of the system? How do we reorient our health system from one being so focused on money to being more focused on health? And those fundamentals, what we've done in North Carolina over the last few years, will continue to pay dividends for generations. And again, I believe many other states are looking to us for the roadmap on how did we get this done in a bipartisan environment. And I think it's because North Carolina leads the nation.
What's next?
I'm going to continue my wonderful time here in Western North Carolina, spend some time with friends and family, and figure it out from there. I'm committed to continuing to make a difference in North Carolina.
Thank you for your time.